When you get a basic difficulty in swallowing the very food that you wanted to eat, it can be a nightmare. Achalasia, Cardia is one of the esophageal motility disorders. Food doesn't enter the stomach, it gets stuck in the food, throat or the chest. The biggest problem with achalasia patients is that lack of awareness. Now incisions, it is totally done in an endoscopic room. Most of our patients, next day they are discharged home with liquid diet form.
Hello and welcome back to Yashoda Health Talk session, where all your health related queries are answered here. Well, food is something that we all enjoy, but certain conditions can make swallowing difficult, making the simple pleasure into a challenging one. So let's know more about swallowing disorders in our today's episode. Joining our discussion today is Dr. Rakesh Kumar Adi, Consultant Medical Gastroenterologist and Endoscopist from Yashoda Hospitals, Secunderabad. Welcome to the program, Dr. Rakesh, and it's so good to have you here.
Thank you for the invitation. And it's always nice and interesting interact with you, Dr. Lakshmi, simply because you bring the facts to the table. You bring the burning questions that the patients have in their mindset. It's always interesting.
Thank you so much. So, having treated thousands of patients with various gastrointestinal disorders, I'm sure difficulty in swallowing is one of the common disorders that patients present to you. So, share some insights about your medical journey and how commonly do you encounter such patients?
Yeah, I think if I take the first question, the medical journey, well, doctor is something that I always wanted to become one.
Oh, wow.
Probably right from my high school days, because my inspiration was Dr. Sheila Dikshit. I think most of you are probably not aware of him, but he's one unique doctor who, in spite of all his adversities that he faced in his life, he continued to run a program called Smile in India. I think he was a plastic surgeon, and he was bent upon treating only one disorder, that was, the split lip, the congenital anomaly that the young child still don't have it. So he was basically from US, but every 3 months he would visit India, and for the next 3 to 5 days that he was in India, he was treating nearly 1,000 to 2,000 of these cleft lip.
Oh,
So that guy was phenomenal. He ended up having stroke twice, but still he came to India. He had a CA larynx. His voice box was removed, that was replaced with an artificial one. Still, he used to come to India to treat patients. And this, I'm talking way back in the 90s and the early 2000s. I think he just missed his Nobel Prize by a whisker. Probably he didn't have good people pushing for it. But Dr. Sheila Dikshit was the one that really inspired me, and I took it on myself that one day I dreamed to become a doctor. So that's how it got triggered. And then finally I ended up joining Usmania Medical College. That's where I did my MBBS.
so when did you decide that you wanted to become a medical gastroenterologist and not probably plastic surgeon?
No. In fact, I wanted to become a surgeon. If you are in Usmania, it's a very old institute, and you get to see quite a big people working there. So all through my housemanship, I was really inspired to become a surgeon. But in those days, getting a surgery, in a entrance, getting into a PG seat for surgery was quite tough.
Yeah.
So when it came to the time where I had to choose, I couldn't get a surgical seat. So I ended up joining the general medicine.
Okay. Destiny had some other plans for you.
So then I decided to pick one super specialty that probably does minimally invasive surgical job as well. So that's how I embarked on this idea of doing a medical gastroenterology.
Wonderful journey. So, doctor, I'm sure food is something that we all enjoy, but certain conditions can make swallowing a bit difficult, turning the simple pleasure into a challenging one. That is, we are talking about Achalasia, Cardia. So, how common in this condition, and which age group is affected the most?
Well, as you have rightly said it, we are all fond of having a good meal. So when you get a basic difficulty in swallowing the very food that you wanted to eat, that's really a daunting task for our patients. So difficulty in swallowing can be a nightmare. And Achalasia, Cardia is one of the esophageal motility disorders. So what do you mean by esophagus? It's, as you know, for a common man, it's the food pipe that connects the mouth to the stomach. So whenever there is some muscular abnormality in the food pipe, this can result in a situation where the entire food pipe goes into a spasm as soon as the patient has the food. So that spasm leads to difficulty in the passage of the food from the mouth into the stomach.
The food cannot be pushed into the stomach.
The food doesn't enter the stomach, it gets stuck in the food throat or the chest. So patient starts having a lot of difficulty in swallowing, chest pain. They have a lot of regurgitation because the food that cannot go down just keeps coming out. The biggest problem with achalasia patients is that lack of awareness. You'll be surprised to know that the average time from the time the patient has the symptoms and to the time they reach us is more than a year. So more than a year, patients suffer just because the patient doesn't understand his problem, and just because sometimes the treating doctor or the physician sometimes fails to recognize that. Most of these patients are actually treated as GERTX or the reflux problem.
That is like, then how do you think that they could have managed themselves without proper nutrition all this while? I mean, that could have had a greater impact treating the disorder, right?
Yeah. See, by the time they come to him, most of them, half the and more above, are malnourished. They are underweight by the time they reach us. That's simply because they haven't been taking proper meal. So by the time they reach us, on an average, we see them losing more than 10 kgs of their weight. So that's quite a big loss for them. But that's how it is. I feel it's the lack of awareness on the part of the patient partly, and also the part of the basic treating physician or the rigid practitioner who sees them to early recognize that this may be a motility disorder that requires a specialist treatment. First hint that probably this is achalasia.
So do you think, are there any certain conditions or any risk factors, or be it our dietary pattern also, which could potentially lead to this condition?
No, actually there is nothing in the food that actually either aggravates or decreases the achalasia cardiac. And see, this is not something that is new. In fact, first description of achalasia was made way back in 1600 itself. Dr. Thomas was there. He was the first one to suspect that people who are coming with difficulty in swallowing, they have something wrong in their food pipe. So our original his treatment was, he would take a whale bone, the big rib of a whale, then tiplo sponge attach చేసి, he would ask his patient to push it through the food pipe.
Okay.
So he was practically trying to dilate the muscle.
Yeah.
So dilate the muscle and తర్వాత తినండి.
Okay.
So that was the first early description of achalasia, and also that was the first time somebody said the muscle is the problem, dilate the muscle, you will have relief.
Interesting.
So from 1600, nobody understood what is the best treatment for it. And then sometime in the early 1920s, Dr. Heller Ravi, he was a surgeon, who said that, Sare, muscle is the culprit kada, anta spastic muscle is troubling my patient kada. What I'll do is that I'll cut the muscle, or what is known as myota.
Heller's myotomy.
So that's how that particular surgeon devised a procedure. Abdomen open chesi, lopatkelli would cut the muscle at the lower esophageal and the sphincter. And that became a very, very phenomenal success. So what has happened in the last 10 years is that somebody like, we had a famous Japanese surgeon, CT surgeon by name Dr. Inoue. So I name annadante, well, if cutting is the cure for achalasia, adi surgically enduku, why can't you do it endoscopically? So with that idea, Dr. Inoue went on to do this procedure of muscle cutting, but instead of doing it surgically, he decided to pass an endoscope, and muscle mucosa majjala, he created a tunnel, and through that tunnel he would reach the lower end of the esophagus and cut the muscle.
Which is less invasive.
Well, who wouldn't want to see? Suddenly here is a procedure where there is no muscle cutting or the abdominal cutting. It is not done in OT. The procedure average time is less than an hour, and within 2 hours your patient is awake, is back to his room. 24 hours later you are off to your home, and probably 3 to 5 days back you are off to your work.
And doing regular activity.
That makes a lot of difference kada mana patient lo. So that has really kind of changed the entire approach to achalasia cardia.
Absolutely. So talking about these minimally invasive techniques to treat swallowing disorders, so one such technique is POEM. So could you brief us what exactly POEM is and how it is done?
So that's a beautiful name actually coined for a minimally invasive procedure. So POEM, as you have rightly mentioned, it's nothing but it's an acronym for peroral endoscopic myota. As I was mentioning, when Dr. Inoue, who is considered as the father of the POEM procedure, he was the one who was chasing this idea. If the surgeon is cutting the muscle to give relief, let me do it endoscopy. So what we are doing as endoscopists is the same. The principle which the surgeon adopts, we are doing the same principle. It is the cutting the muscle. So clinical success and technical success is as good as the surgeon. But only thing is that we are doing it endoscopically through the mouth. That's how peroral endoscopic myotomy came into vogue.
Without any external incisions or
No incisions. It is totally done in the endoscopic room. On an average, probably now that we have done more than 600 to 700 procedures, probably my time is less than half an hour. So in half an hour, I am done. 2 hours, the patient is up and probably goes to the room. And most of our patients, next day they are discharged home with liquid diet form.
That's wonderful. So the recovery phase, which is also important, even a particular precautions or any instructions that patient should follow, doctor?
Well, that's the beauty of the procedure, that you don't require much of any precautions. It's liquid diet for 2 days and then you're on soft diet or your regular diet.
That's
And we have done it for as elderly as 80 years old guy, and we have done it as young as 5 years. In fact, I think 1 week back, we have done it for somebody who was like 6 years. So patient has come from Indore, all the way from Indore, understanding that we are trying to do something, and yes, we were able to palliate his symptom, what he was suffering from for 2 years. We did it. I think I did it on Saturday, and the Monday the guy was back to home.
That makes life so much easier for the parents and for everybody as well. So, doctor, OM being a recently innovative technique, are there any myths surrounding this that you would like to clear for our viewers out there?
No, rather the myths, I would rather say the facts, I would put it forward. I would definitely say and reinforce this idea that it is minimally invasive. So the beauty of the procedure lies in the fact that the patient is back. He bounces back to his regular life probably less than 48 hours. And if the myth is, probably one myth is that is it as good as what the surgeon does. That was the initial myth we had, where the patient said that surgeons were better than you. But let me tell you, in the last 10 years since the procedure has been in the vogue, we have found that the technical success, the clinical success is as good as what the surgeons would do. The other myth was that reflux. మీరు మజిల్ కట్ చేస్తున్నారు కదా, సో దెర్ ఇస్ నో స్పింక్టర్ మెకానిజం, సో యూ విల్ హ్యావ్ లాట్ ఆఫ్ రిఫ్లక్స్ అని. బట్ లెట్ మీ టెల్ యూ, ఇండియన్స్, అవర్ యాసిడ్ ప్రొడక్షన్ ఈజ్ వెరీ లో.
ఓకే.
సో ద రిఫ్లక్స్ ఇన్సిడెన్స్ ఈజ్ నాట్ హై. రెండోది, పేషెంట్ ఈజ్ ఆల్వేస్ హ్యాపీ టు ఈట్ అగైన్ కంఫర్టబుల్లీ, and some acidity is ready to pop one antacid to handle it.
He is ready to accept and what it was. So, do you think patients would come back to you after doing this procedure with similar complaints? I mean, are there any chances of relapse?
Here we have to understand one thing, that at the end of the day, we really don't know why the muscle has suddenly become spastic. Muscle enduko it's really irregular or odd, we don't know.
We don't know the root cause.
We don't know the root cause. So whether it is surgical side or endoscopic side, we are cutting the muscle. So we feel that cutting the muscle will give you the respite of your symptoms. So going forward, will it come back? Based on the literature, if I am to quote the literature wise, they say that 3% is the risk of relapse after 10 years.
So thank you, Dr. Rakesh. It was wonderful interacting with you. So before we wrap this episode, is there any message that you would like to share with our viewers out there?
Yeah, I think the only message probably I would give around is that motility disorders of the esophagus have been there and are there. Only thing is that awareness has been poor. So if you are consistently encountering some difficulty in swallowing or lot of regurgitation, vomitings is happening on regular basis, I think you should approach your professional health care, the sooner the better. Now we have enough diagnostic modalities to pick up these symptoms early. And apart from endoscopy, there is manometry which has come up. And this manometry is a real-time investigation trying to understand how the food bolus is moving into your food pipe. So these manometry, they can pick up the achalasias quite early. So if any of you are encountering difficulty in swallowing with lot of chest pain and regurgitation, I think they should approach the nearest health professional, and probably they can guide them to a gastroenterologist.
So this brings us to the end of this episode. Hope this episode was informative on the topic swallowing disorders, and don't forget to join us for next week as well. Until then, take care and stay healthy. Thank you.